So blood pressure, what is blood pressure? So you can say that arterial blood pressure, because whenever we talk about pressure, we measure the arterial blood pressure. Okay, and you can say that it is defined as the pressure exerted by the blood. Blood is creating a pressure on the wall of the blood vessels. Like suppose this is the blood vessels. Some blood cells are moving. So this blood which is present inside, they are creating a pressure on the wall of the blood vessel like this. That pressure is being measured, and that is called blood pressure. Simple, right? So you can say that pressure exerted by the blood on the walls of the blood vessels in which they are present. Simple. So one line definition, you can say that uh, it is defined as the pressure exerted by the blood on the wall of, or you can say on the blood vessels in which it is present. Okay, so first of all, there is an instrument used to uh, measure this particular pressure. Do you know what is the name of that instrument? Any idea?
Manometer.
Yes, sphygmomanometer. Yeah. So this is an instrument used to measure pressure, and that is sphygmomanometer. And this is the machine which was first discovered by a scientist called Carrot in in 1905. That was the first major invention, you can say, in the field of medicine, because earlier it was very difficult to check the cardiac problem, because people were not aware about the instrument, how to measure the pressure, how to just they if a doctor is more experienced, they just used to touch the body parts where the pressure can be felt for some time, like 5 to 10 minutes, and then based on that they predict that is there any problem or not. So you must know who has invented this. So let me write here, in invented by Carrot. His full name is Carrot Cough. In 1905, it was a major discovery. Then, in this particular blood pressure, the blood pressure is measured in terms of the air pressure, right? So this is called oscillatory method. Means we are going to check the pressure in terms of the air pressure. How much pressure is there? Then we give the unit also, like mm of Hg, like that. So next point you can say that uh, in this particular method, in this the blood pressure is measured in terms of air pressure, and this is called, there is a term given to this, osculatory osculatory method. And this is actually an indirect way of measuring the pressure. Okay, so let me write here as a note point that it is the indirect. I will say you how I'm saying it is an indirect method. Indirect method of measuring blood pressure, BP. So BP is, first of all, have two components. Okay, whenever we measure the BP, blood pressure, there is a two component, and so you can say two component of BP, and it is measured in of Hg, measured in unit. Now, what are the two components? Let's talk about that. So the two components are, let me write it here, the systolic blood pressure, called SBP in short form. You can say systolic blood pressure, and the second is called diastolic blood pressure, DSP, diastolic blood pressure. Sorry, this is B. So if you can measure these two pressure, you can find out the blood pressure. Okay, so that's simple. So blood pressure consists of the two component, systolic pressure as well as diastolic pressure. Means when heart is when heart is contracting, at that time what is the pressure in the blood vessels, and uh, when the blood vessel is relaxing, I mean the heart is relaxing, what is the pressure in the blood. Okay, so one by one we will talk about these two units, main component. So first is, let's talk about what is SBP, what is systolic blood pressure. So systolic blood pressure is the pressure exerted by the blood on the wall of blood vessels at end of the ventricular systole. Okay, you can say one line, that pressure exerted by blood on the wall of vessels at the end of ventricular systole. Any idea what is the normal SBP in adult?
120.
120, yes. So in normal healthy adult, under resting condition, always remember, whenever we say healthy, uh, a person have SBP, that is always in under a resting condition, under a resting condition, because when person is doing any physical activity, then this SBP will change. It is 120 mm of Hg. What is DBP? DBP is again same thing. It is a pressure exerted by blood on the wall of the blood vessels when the ventricles are relaxing. So one ventricle is contracting and one ventricle is relaxing. So you can say pressure exerted by blood vessel, by the blood on the wall of blood vessel at the end of ventricular uh, when the ventricles are at ventricles are at maximum relaxed, at maximally relaxed. At that time, whatever blood pressure is there, that is called diastolic blood pressure. And this is around 80 mm of Hg in a normal healthy person. So in normal healthy person in resting stage is 80 mm Hg of mmHg. Right? So these are the two blood vessels. If these two pressures, if you will combine, you will get blood pressure. Simple. So you can say here that blood pressure is equal to systolic pressure by diastolic pressure, right? Diastolic pressure, which is around 120 by 80 mm of Hg. This is the normal value. Any idea is what is the newly born baby have the blood pressure? Any idea? Any guess? Like
No idea.
no idea. Actually, the highest blood pressure, like around, um, I guess, wait, newly born baby, when they are in the fetal stage, at that time they have maximum blood pressure, maximum when they are in the fetal stage. When the child is born, at that time their pressure is around 90 by 90 by 55 mm of Hg. That is for newly born child. So let me write here, newly born child, BP will be 90 by 55 mm of Hg. And in young adult, we have seen this is for young adult. It's not gender based, any male and the female. And what about old people? Old age?
They usually have higher blood
Yeah, they
pressure.
have higher 150 by 90 mm of Hg. So with age, you will find that the blood vessels are actually losing their elasticity, their contractibility, their relaxability, right? which results in the high blood pressure because blood have to move more faster to maintain the pressure because the elastic nature is not there. Slowly it's getting decreased. So you can say here that with age, mm, blood vessel lose their elasticity, can result in high blood pressure. That's why some people have high blood pressure. Sometimes calcium get deposited in the blood vessels, which causes arteriosclerosis, which is a condition in which um, blood vessels is contain. I mean, it is being um, deposited by the calcium. So that condition is called arteriosclerosis. Means one line you can say deposition of calcium in blood vessel. Again, the BP is also based on elasticity. Apart from this, blood pressure is also depend on the viscosity of the blood, how thick the blood is. If the blood is thin, the blood pressure will be normal, right? But as the thickness starts increasing, means the blood is becoming more thick, more solutes are there, then the flow will be disturbed. That's why if the person having any cardiac disease or any heart related problem, doctor gives a tablet which makes the blood thinner, right?
Mm.
So when the blood will thin, means there is less solute, it's like a watery, then the flow will be faster, right? Like if you have to throw water and you have to throw honey, right? Which will go fast? Water will go fast, right? Honey is thick, so its flow will be disturbed, right? So that is another factor which controls blood pressure. I'm writing here that viscosity of blood also increases with age. This results in, and this is the normal thing. It as the age will progress, these things will come. This results in total peripheral resistance, and high blood pressure. So body is also trying to maintain the thickness of the blood. There are some hormones like ADH, antidiuretic hormone, which controls the blood thickness. If there is less water, then it triggers kidney to release less water in the form of urine. That's why the urine color becomes yellow. When you have more water, ADH will send information to kidney to release out extra water from the body. That's why the urine color becomes watery. Right. So everything is being maintained by the ADH, and in this way the blood thickness is also maintained. There are some other factors which results in the increase in the BP, uh, like exercise, hypertension, fear, anxiety, depression. These are some other factors which also affect the blood pressure. This is the last point. Let me write other factor. Other factor which increase blood pressure are exercise, then tension, fear condition, anxiety, and depression. So these are few things, few factors which is controlling the blood pressure. Any doubt? I guess this is enough. Right? We'll move to the pulse part.
Yes, sir.
So generally heartbeat, if you will check the heart beating per minute is exactly the same like pulse. So there is a wave of distension and recoiling is felt in an artery. I mean, especially in the radial artery, due to contraction of the ventricles, which forces around 70 ml of blood from the aorta, and um, that 70 ml of blood which is coming out forcefully from the ventricle when it is going to get contract, that's called stroke volume. Stroke volume is the volume of the blood which comes out forcefully from the ventricle, 70 ml. And so due to forcefully expulsion of the blood, right, there is some wave of distension is felt in the artery, and that when that is going to get measured, you will get the pulse, right? We'll write few points about it. So first, what is pulse? So you can say pulse, a wave of distension and recoiling, means again come back to the normal. Recoiling felt in an artery. I mean, especially they take radial artery. Due to why this is? Due to contraction of ventricle which forces 70 ml, and this is the stroke volume. 70 ml of blood in already full aorta. So that blood which is forcefully coming out, right, that force create some kind of wave of distension in the blood vessels, and that is being measured and you get the pulse. And this radial artery is a very easy way from where you can get the exact pulse. So you can say that pulse can be felt easily. Sometimes it's very difficult for some people in some cases to find the pulse, right? So they can't find the pulse in the radial artery due to a deposition of fat on the outer layer of the body, outer skin layer. So they checks some different position from where they can find the pulse. So pulse can be felt easily in radial, means radial artery, that is in wrist, right? Then temporal artery. Temporal artery is the temple region over temporal bone. I will show you the position. Temple region over temporal bone. Then what else? Third is on the foot, and the blood vessel is called dorsalis pedis. Dorsalis pedis artery. This is present in leg. Sorry, you can't say leg, you can say foot. And the last is carotid artery near the neck. Carotid artery. This is in the neck region. Sometimes people used to check the lower part of the neck. Sorry, the upper part of the neck below your cheek, right, like this, and they find the pulse. One more artery is there where you can find the pulse, that is ankle joint, and the name of the blood vessel is posterior tibial artery. That means ankle joint. Here, so these are all places. You want to see where exactly they all are? Wait, let me show you. Because when you are going in a medicine, you must have these locations. Let me show you radial artery location. Yeah, this one. This particular blood vessel, this one, which is going
Oh.
towards the thumb side. If you will see, you can find pulse there. Even right now also, if you will touch. And how to touch, there is a way also. Gently put your fingers, very gentle. Don't pressure, don't apply pressure. Try to feel the flow of the blood. Try to feel the detention, recoiling, wave-like motion on the blood vessels. This is radial artery, where you can get pulse. Second is carotid artery. See, carotid artery is here, either both the side of the neck, right side, left
Mm.
side. If you will touch, you will find the pulse here also. If doctor is unable to find pulse in the radial, the very common place where people find the pulse, I mean the doctor used to find the pulse in the neck region. This is called carotid artery. Next is tibial artery. This is tibial artery. This is the I mean the leg region. I'll show you some other diagram. Yeah, this one, tibial. From side you can feel this pulse. Next is dorsalis. Let me show you that. This is dorsalis. This is the only blood vessels which is, I mean, not only, more prominent, you can say. You can easily see in your legs also. This is called dorsalis. Then temporal. Let me show you the temporal artery. Temporal artery. Temporal artery is here. See, near the ear. Can you see?
Hmm.
Why it is temple reason? Like temple is like a dome shape is there, right? That's why. Okay, let's move to the last part of this pulse. That what are the factors affects the pulse? So generally, pulse is affected by first of all age. That's very important. Second is the posture, how you are sitting, how you are. What is your body orientation? That also affects the pulse. Then uh, your anger, like some emotions, if you are in some different mental or physical state, at that time also your pulse will get affected, like when you are in the anger, when you are in the anxiety, when you are so happy, when you are in a fear condition. In all these physical and mental state, your pulse will get affected, and it will give you the different variables of the pulse, right? So we'll write the last point about the pulse. You can say pulse is affected by number one, posture, posture of body. Second, age, right? So 72 per minute in adults, which is very common. Even if you will count your pulse, you will find that the normal value is from 60 to 90. So on an average, they say 70 or 72 is the normal pulse rate. So, so I'm writing the average, that is 72 per minute, 72 per minute in adults, and around 120 per minute in children. And again, it will be higher in the old people, or no, old people have the slower. A newly born child have 140 per minute pulse in newly born child. Then the third factor which controls pulse is sex. Pulse in female is faster actually with respect to the male. So you can say pulse in female is faster than male. Then last is emotions. Emotions such as anxiety, fear, anger, happiness. So if you will check your pulse in all these different body physical situation, you will find that your pulse value is also changing. It's not constant. So that's it for today.